Our final presentation this morning is Dr. Robert Rolf. Dr. Rolf's area of expertise includes shoulder and elbow arthroscopic techniques, complex shoulder reconstructive surgery, tendon transfer, shoulder replacement, reverse shoulder replacement, shoulder and knee injury, fracture management. Dr. Rolf is also an affiliated physician with Beacon Orthopedics, and we'd like to welcome him. Thank you.
So I am a shoulder specialist, but I do sports medicine and still dab in the knee a little bit. I'm going to talk about upper extremity joint pain and where do we stand today. I think there have been some advances, specifically in the shoulder, with different types of surgery that we're able to offer patients that have changed a lot over the last 10 years, and that's one of the reasons I chose to go into shoulder surgery. So the shoulder is essentially two major joints. It's the scapula on the ribs, and it's the ball and socket. It's a little bit different than the hip in that the hip is a ball in a socket and the shoulder is a ball on a socket. And that's why the rotator cuff plays such a crucial role with shoulder pain. We like to take MRIs of the shoulder to see what's exactly going on with that rotator cuff. We know a lot with the physical exam, but there are different reasons you can have shoulder pain and an MRI plays a role. This is what a rotator cuff tear may look like. And here you have a little bit of white where there's a tear. So this is what we're looking at when we look at the MRI. Arthritis is another common problem in the shoulder. We know that arthritis affects about 43 million Americans annually, and there are hundreds of types. The most common is osteoarthritis. This is the wear and tear arthritis that Dr. Chaudhary was talking about. So what do we need to know? When you come into our office, I need to know, one, you have pain, because I don't care what your x-rays look like. If you don't have pain, I'm not going to operate on it. I want to know that you have pain at night, and I want to know that this is affecting you. So I want to know, what is your perception of a normal shoulder? If you tell me, I have a lot of pain, but I think my shoulder is 95% normal, it's hard for me to convince myself or yourself to have surgery. If you come in and say, I think my shoulder is 10% normal, then I think we have something that's going to really help you in the end. This is what we want to look at. This is an animation just showing you how a shoulder should work. If you can lift your arm, if you have good function, but you have an irreparable rotator cuff tear, then a partial shoulder replacement is a better option for you. In fact, when I do a shoulder replacement, this is what I'll see. I have a shoulder replacement that I can change the angle based on how I prepare your humerus on your anatomy. And so what I'll do is I'll cut that arthritic bone off. I'll then prepare the canal with a series of broaches that tries to tell me the best size for your anatomy. And so as we put this in, we'll sequentially go up in size until we put it in the bone and we get a nice fit. So once I put this broach in, I can then take the ball that's going to become part of the final component, and I will put that ball on, and I'm able to rotate it in position or tilt it in position to match the geometry of your shoulder. And that's what you'll see here, where we put the ball on the broach. We have the ability to rotate it, we have the ability to bend it. So we initially put it on. It doesn't fit quite right, but we can rotate it to match your anatomy. We then will fix this ball based on your anatomy. We'll put a screw in that ball to lock it where we just put it, and then we'll put it on its stem, and that is your shoulder replacement that is specific to your shoulder, and that's why we're doing a lot better with shoulder replacements than we did 15, 20 years ago. So we take that broach out, and we've now made a shoulder that we're going to put in your humerus, and that's your new shoulder on the humeral side, and then we'll actually put the plastic liner on the socket side. So I've recreated a round peg and a round hole, and you're no longer ratchety with your shoulder arthritis.